sure you're not ready? Okay, so this one we're going to be doing is a neurological assessment. So basically what we're going to be doing is going through and do a neuro. Okay, on scene, making sure we've got PPE on, scene safety and that sort of thing. Standard caution, as I said, speed, you're going to explain the patient procedure to the patient. So basically we're just going to do a neuro exam, okay? Alright, we're just going to see how you are with your Glasgow coma scale and fast exam, which I'll explain to you fairly shortly. Alright? Okay. Hi, my name's Rick. What's your name?
Abby.
Okay. So as she responds to me well. She's breathing. She's sitting upright. She's alert, responsive voice, has no pain, and is definitely not unresponsive. Okay. So fast exam. Okay. Basically, we're going to looking for any signs of stroke. Okay. So facial sort of expressions. That's one. Can you show me your teeth? Yeah. So I can basically see that both sides of the mouth rise. Asymp. Yeah, both at the same time. All right. So that says so there's no facial weakness to one side or anything. Okay. Arms. So can you stretch your arms out for me? Okay. Beautiful. All right. Now close your eyes for me. Okay. Close your eyes. Yeah. Okay. Cool. Awesome. You can open your eyes now. So basically what they say there, so like hands basically stay in the same spot. Person who's suffering from straightness, so then usually arms sort of like one side will actually drop down when they close their eyes. Alright. Speech, can you say 99 for me?
99.
Okay, say Mississippi.
Mississippi.
Beautiful, okay. So there's no slurred speech or anything like that. Okay. Time of onset, well there's no signs of stroke, so there's no onset time or anything like that. For the person suffering from ischemia or stroke, then have an onset of when it didn't seem normal, we'll ask the family. Okay. AIOU tips. Okay. Drink alcohol?
No.
No. Awesome. Do you suffer from epilepsy?
No.
Okay. So A is for alcohol or acidosis and that sort of thing. So that's what. E for epilepsy. Doesn't suffer from epilepsy at all. There's no signs of infection, either respiratory or any other else. She's alert and responsive, so there's no sign of overdose for overdose. U for uremia, yeah, I'll get it right one day. Kidney failure or any sort of urinary problem like that. T for any trauma, well there's no signs of any trauma and that sort of thing. She's not showing any signs of any trauma. She's not showing any pain anywhere. Do you take insulin?
No.
No? They haven't been diagnosed with diabetes?
No.
Okay, so there's I for insulin, so there's no hypoglycemia or diabetic ketoacidosis. You're not a psycho?
No.
Okay, cool. So there's no psychosis. And you haven't been bitten by anything?
No.
No spiders, snakes or anything like that? Okay, so there's no poison. And yes, for stroke or seizures. So she hasn't presented with any seizures and did the fast exam to actually sort of rule out any signs of stroke. BSL for hypo or hyperglycemia. We'll take a BSL reading to find out what the sugar level. Normal sugar level is between 4 and 8 mmol/OL. Alright. Glasgow coma scale. Eye responses, normal eye responses, so she's looking at me. If I put my finger there, and she's sort of moving quite alright with the eye response. So that's 4 points. Verbal responses, she's responding to me. Can you hold your hand up for me? Beautiful. Okay, drop it down. Yeah, so she's responding with verbal response and also motor response. So there's a 5 and a 6 points, and give it a GCS of 15. Pupil response. We'll just check the pupils. So I'll quickly use a pen light to see if the pupils actually react. So just look straight ahead for me. And there's a reaction. And we've got equal reaction on both sides. Pupil sizes are around the 2 to 3. Oh, sorry, my bad. About 3 to 4 size. And their reaction is quite brisk, so their normal reaction. And yeah, so if we sort of think meningitis and that sort of thing, we do the two tests, whether it be the Koenig's or the Radzewski thing, where we lift the legs up and sort of see if there's any pain behind the knee, or lifting the head up where if there's any, sort of lifting of both knees to see if there's any meningitis and that sort of thing. But besides that, I think you'll find all good, and we're done.